The Plastic Surgery Channel News, brought to you by Mentor, maker of memory gel breast implants.
Welcome to Plastic Surgery News. I'm your host, Deanne Moore. Thank you for joining us today. In this week's report, learn just how much plastic surgery really helps a fractured nose, find out how eyelid surgery can affect self-image, and discover what one drug company is doing to keep the FDA from telling them how to market a popular neurotoxin. All of that coming up, but first, brow lifts are a popular procedure for creating a more youthful look. But depending on the surgeon's skills, the operation can produce uneven results. Some patients who get a brow lift end up looking constantly surprised. Now, a new study shows that a certain technique can provide the proper look. The study focused on two groups of women undergoing brow lift surgery. The first group ranged from the age of 20 to 30, and the second was between ages 50 and 60. Now, the study examined the facial measurements of the women in both groups before and after their brow lift. The overall findings were that the eyebrow area became naturally elevated with age, and surgery on the mid and medial brow area produced results that didn't look youthful or aesthetically pleasing. Doctors concluded that elevating the lateral brow area can offer the most natural look, and surgeons who take this approach can save their patients a lot of surprise. The study appears in the current issue of the Journal of Plastic and Reconstructive Surgery. Now, in other news, a new study indicates that computer imaging can be a useful tool to help surgeons and rhinoplasty patients decide how the patient's new nose should look. The report, published in the Archives of Facial Plastic Surgery, indicates that computer imaging software helps doctors offer their patients the ideal nose. Researchers at the University of Wisconsin studied 20 women who were undergoing rhinoplasty. They examined each patient's facial proportions before and after surgery. The researchers found that most of the desired parameters were close to the ideal, but this ideal isn't based on celebrity examples. Instead, it is based on proportions of the aesthetic face. This is the 1984 standard established by the American Academy of Facial Plastic and Reconstructive Surgery. The researchers later concluded that doctors are using computer imaging software to store information about common patient preferences, and they can also use it to help future patients make choices that work just as well. Coming up next, a new survey reveals how much good it can do to fix drooping eyelids. But first, a quick break. We'll be right back in just a few minutes.
Hi, I'm Dr. Bill Adams, and you're watching the Plastic Surgery Channel. Last year, more than 350,000 women decided to get breast augmentation.
It helped me understand what my body would be like after the surgery.
And speaking of hard facts, let's talk about your olfactory organ.
So a prospective patient, when they're looking to have surgery, must always understand that every single surgical procedure has its import, and they must be concerned with the quality that's being delivered to them.